Welcome back to another chapter. We are going into chapter 3, lifting and moving patients. The topics we are going to talk about are protecting yourself and body mechanics and protecting your patient with emergency, urgent, and non-urgent moves. In this section, we are going to talk about protecting yourself and body mechanics. So first and foremost, what is body mechanics? Body mechanics is the part that refers to the proper use of your body to prevent injury to facilitate lifting and moving. So you want to consider the following before you do any lifting and moving. But the proper use of your body to prevent injury and to facilitate lifting and moving is going to help you in the end. So a few things to consider. Before you lift an object, before you lift a patient, what is the object? What is the weight of it? And will you require any additional help for lifting? Are you strong enough? Is your partner strong enough? Or do you need to call in for additional help? You also have to be honest. Before you lift, you have to know what your limitations are. What are your physical characteristics? Are you too short compared to your partner? That is a body mechanic that a lot of people don't think about. If you're 5'4" like I am and your partner is 6'5", how is that going to work? If if you can bench 250 pounds and your partner can bench 75 pounds, what's the problem there? Okay, so know your limitations, know your partner's limitations, and then communicate. By making a plan and communicating the plan before lifting and carrying your patient will help you and your partner to not get injured. But while you're doing this, you're going to continue to communicate throughout that process of the move to make that patient comfortable, but more so to make sure that you don't get injured or your partner. So when it comes time to do the lifting, there are rules that you must follow to prevent injury. First is positioning your feet properly. They should always be on a firm, level surface and positioned shoulder width apart. Next, you want to use your legs. Do not use your back when lifting. Never twist or turn. Attempts to make any other moves while you're lifting are a major cause for an injury. And do not compensate when lifting with one hand. Avoid leaning to either side and keep your back as straight as possible and locked. You always want to make sure that you keep weight as close as possible to your body. This allows you to use your legs rather than your back while lifting. So the farther the weight is from your body, the greater chance of injury. And next, using a stair chair when carrying a patient on the stairs whenever possible. So it also helps keep your back straight. You want to flex your knees and lean forward from the hips, not the waist. And if you're walking backwards down the stairs, you always want to be sure to ask for a helper to steady your back. As you can see in this picture here, they are moving with a stair chair down the steps. You have one at the head, one at the feet, and you have that extra person that's holding the back, and they are guiding that person down the stairs backwards. So take a step, take a step, take a step, okay? And then putting your hand on their back. It just helps them feel more stabilized. There's two different types of cots that are out there. A lot of EMS agencies are going to the power lift cots just because it is helping with injury to staff. But there's also the power grip, and that is strictly holding lifting the cot up by yourself, and you actually have to grip the release handlebars for the wheels to go down. So just know and understand which cot you will be using for the service that you're going to be working for. When you're reaching, you want to keep your back in a locked position. Avoid twisting while reaching. Avoid reaching more than 20 inches in front of the body, and avoid any prolonged reaching when strenuous efforts is required. When pushing or pulling, you want to push rather than pull whenever possible. You want to keep your back locked in. Keep the line of the pull through the center of your body by bending your knees, and keep the weight close to your body. If the weight is below your waist level, you want to push or pull from the kneeling position but avoid pushing or pulling overhead. And then keep your elbows bent and your arms close to your sides. In this section, we are going to talk about protecting your patient with emergency, urgent, and non-urgent moves. So with emergency moves, there's some situations you have to think about, and there's 3 situations that require the use or may require the use of an emergency move. The first one is that the scene is hazardous. The next one is that the care of life-threatening conditions require repositioning. And the last is that you must reach other patients. And that means like when there's other patients at the scene requiring the care for life-threatening problems, you may have to move one patient to access another one. In this picture, they're doing what's called a clothes drag. So they're actually grabbing onto the clothes and they're dragging that patient. The thing here is that you're going backwards more than likely, and so you could trip and fall. So just know what's behind you and around you. In this move, they're doing what's called the incline drag, and it's always head first. So you're grabbing around underneath their armpits, and you're letting their feet drop on each stair as you go down. This here move is known as the firefighter's drag. That's where you place the patient on his or her back and tie the patient's hands together. You're going to straddle the patient. You're going to crouch and pass your head through the patient's trussed arms, so where their arms are connected. And then you're going to raise your body and crawl on your hands and knees, keeping the patient's head as low as possible. And this is typically something that you will see in a fire situation. But again, if you're not trained to go into a fire, you should not be going in there. Here's another emergency move called the blanket drag. So you're going to gather half of the blanket material up against the patient's side, roll the patient toward your knees, place the blanket under the patient, gently roll the patient back onto the blanket, and then during the drag, you want to keep that patient's head as low as possible. So as you can see here, the blanket's rolled up. They can grab it with one hand and pull. However, depending on strength of the person pulling, that may not work so well for you. So you may have to go backwards. Here you can see the one rescuer assist. Basically, it is what you see. You throw the arm around your shoulders and just guide them to where they need to go. Here is the 2 rescuer assists. So you're going to place the patient's arms around the shoulders of both rescuers. They each grip a hand, place their free arms around the patient's waist, and help them walk to safety. The next one is urgent moves. So urgent moves are required when the patient must be moved quickly for treatment of an immediate life threat. However, unlike emergency moves, urgent moves are performed with precautions for spinal injury when necessary. So some examples are the required treatment can be performed only if the patient is moved. So a patient must be moved to support any inadequate breathing or to treat for shock or altered mental status. And then the next one is factors at the scene that cause the patient decline. So if the patient is rapidly declining because of heat or cold, for example, the patient might have to be actually moved. So just remember that usually they can be moved on a backboard, which is the best option because you have a little bit more stability for them. And if they do have a spinal injury, that is the best for them to be cared for. With non-urgent moves, that means there's no immediate life threat to the patient. They can be assessed and treated and then moved in a normal way. And then you want to take all required precautions not to aggravate the existing condition. With some patient carrying devices, you have a stretcher or any other device that is designed to carry the patient safely to the ambulance and or to the hospital. So for instance, wheeled stretchers, you have powered cots, which are the ones that are powered, the manual stretchers, which are the ones that you're physically lifting and moving, and then you have the bariatric stretchers, which are some are actually rated to carry patients weighing at least are up to 800 pounds or even sometimes more. So here's an example of a wheeled stretcher that is carried on every ambulance. And these can be, again, the powered or the manual cots. Here's a powered stretcher. This is a Furno stretcher actually. So they do have different brands of powered stretchers. An increasing number of emergency departments are also being equipped with hydraulic lifts to transfer obese patients onto hospital cots. With the world becoming more obese, we just are doing everything that we can to help alleviate injury to the EMS providers. Some other options for carrying devices are the stair chair, which is useful when stretchers cannot be easily maneuvered. So up or down stairs is always a good one. You got a spine board. You have the short board, which is rarely used in EMS practice. And it should be actually a little bit more used, but I get why they're not. And then the long spine board, which is primarily for removing patients from vehicles when they have a neck or spine injury. Here is a stair chair. Again, they have different brands of stair chairs. So again, making sure that you go back to your respective department and learn how to use the stair chair that your department will be using. Here's some examples of long spine boards. They're all pretty much the same, just different colors, a little bit of different shape, but for the most part, they're all going to be that plastic, hard plastic boards. Some other types of stretchers that are out there are portable stretchers, scoop stretchers, basket stretchers. That's typically what they'll use from a fire department or wildland or even helicopter. You have a flexible stretcher, which is, I've seen some that are like vacuum splints, and then the vacuum mattress as well. So just know what your department uses. There's so many different ones out there now that it's hard to teach on every single one of them. Here's a scoop stretcher. This one works really well if you have a patient that is stuck between a bed and a closet and you just can't get back there. Maybe one person can sneak back there, but that's it. You can actually pull this board apart and come in from either side of the patient and snap it back together and lift them and move them out. And the basket stretcher, this is again the ones that typically fire departments, wildland, rescue, or helicopters you would see in their vehicles. And here is what they mean by the flexible stretcher. So some of these actually have right in the middle a crease where you can actually bend them in half and store them in a smaller location. Here's an example of a vacuum mattress which can be used to transport a patient. The nice thing with this is that where you talk about having to pad the voids on a long spine board, this vacuum mattress hopefully will actually conform to the patient, so there shouldn't be any gaps that you have to worry about. The other nice thing about this is when the patient is placed on the device and the air is withdrawn, the mattress then becomes a rigid and conforming and automatically padding those voids. So again, it is a nice little tool to have. Not all areas have these, but they are a very nice tool. So something to think about. How do you choose the appropriate patient carrying device? Well, again, going back to communication, talk with your patient, talk with the family, talk with your partner, find out what is going to be most comfortable for your patient and go with that. Or it might not even be comfortability. It might be maneuverability. So it might be that you and your patient wants one thing and you and your patient are like, or you and your partner are going to say, sorry, that's not going to work going out the door or around that corner. And our device or our equipment that we have won't work, but we could use this. So thinking about it, communicating, and clearly explaining what you want to do before doing it. Next, we're going to talk about moving patients onto carrying devices. So with any suspected spinal injury, you want to immobilize the head, neck, and spine before you move them. You're going to perform manual stabilization, put that rigid C-collar on, and restrict any movement of the neck and the spine. So with patients with no suspected spine injury, you can use the extremity lift, which is used to carry a patient to the stretcher or to the stair chair, and it can be used to lift the patient from the ground or a sitting position. So here is an example of the extremity carry. You can also do a direct ground lift, lifting the patient from the ground directly onto the stretcher. And here is what the direct ground lift would look like. So the stretcher is set in its lowest position possible, placed on the opposite side of the patient from what you are. The EMTs are facing the patient. Drop to one knee if possible and place the patient's arms on the patient's chest. Then the head and EMT, the one at the head of them, cradles the patient's head and neck by sliding one arm underneath the neck and grasping the shoulders, moving the other arm under the patient's back. And then the EMT at the foot end slides one arm under the patient's knees and the other arm under the patient above the buttocks. But if there is a third rescuer, utilize them, okay? That rescuer should be placed both arms under the patient's waist while the other two slide their arms up to the mid-back or down to the buttocks. However you feel it's most appropriate and going to cause least amount of injury. Here's another example of the direct ground lift. So on signal, the EMTs just lift the patients to their knees. On the count of 3, they go up into a standing position and then onto the cot. Again, on signal, the EMTs stand and carry the patient to the stretcher, drop to one knee, and roll forward to place him or her on the mattress. There's also the draw sheet method and the direct carry method available if there is no suspected spinal injury. So the first method is to loosen the bottom of the sheet of the bed and roll it from both sides toward the patient and place the stretcher rails lowered parallel to the bed and touching the side of the bed. Then that's when the EMTs use their body and their feet to lock the stretcher against the bed, and at that point pull the patient over. At that point, again, like I said, the EMTs pull the draw sheet to move the patient to the side of the bed. Use both hands to support the patient while they reach under the patient and grasp the draw sheet. Then they simultaneously draw the patient onto the stretcher. You will hear us talk about the recovery position often, and this is what a patient in the recovery position will look like. So they are on their side with one hand up near their head and the other one on their hip. So positioning for shock, you are going to place the patient believed to be in shock in a supine position. Do not lower the head and do not raise the legs. When you're transferring the patient to a hospital stretcher, you will move the patient from the ambulance stretcher to the hospital stretcher with that modified draw sheet method. There are times that they do have what's called a people mover. It's a mattress that goes underneath the sheet, I believe it is, and they typically have those at the hospital. There are some EMS agencies that have it. Otherwise, the sheet that the patient is on the cot, you can actually have a person at the head end, the foot end, and maybe one on each side of the patient and do a sheet pull or modified draw sheet method. So position the raised ambulance cot next to the bed, and then the hospital personnel adjust their stretcher to what your cot is, and then that's when they can receive the patient. If you have to, you can raise or lower the head of the bed to better fit that patient's needs. Next, you and the hospital personnel are going to gather the sheet on either side of the patient and pull it taut to transfer the patient securely. Then holding the gathered sheet at support points near the patient's shoulders, mid-torso, hips, and knees. That's when you and the hospital personnel slide the patient in one motion onto the hospital stretcher. You want to make sure that the patient is centered on the stretcher and that the stretcher rails are raised before turning the patient over to the emergency department staff. All right, that was a quick chapter, so let's do a quick review. The process of lifting and moving patients is a task that requires planning, proper equipment, and careful attention to body mechanics to prevent injury to your patient and to yourself. The most important rule in lifting is to lift with your legs, not your back. You want to keep your feet shoulder width apart and keep your knees bent. Rules for lifting are for patients as well as equipment. Emergency moves are those that may aggravate the spine injuries and therefore are reserved for life-threatening situations. Urgent moves are used when the patient must be moved quickly, but there is time to provide quick, temporary consideration toward preventing and aggravating any spinal injuries. Non-urgent moves are normal ways of moving a patient to a stretcher after performing a complete on-scene assessment and restricting movement of the spine when necessary. Positioning the patient for transport should take into account that the patient's comfort, medical needs, and safety are met. Remember the importance of correct lifting and moving techniques on every call. Protect your patient and protect yourself from injury to maintain a long and positive EMS experience. Proper lifting technique is an important wellness strategy. Biomechanics and rules of lifting help prevent injuries associated with it. Many different patient-carrying devices exist. Choose the correct device based on the particular patient and the need of particular movement. It could become even part of your body mechanics and your strength or your partner's strength on what device you actually choose. Use proper technique to move patients onto patient-carrying devices and position them for transport based on their condition. Questions to consider. Why are body mechanics so important when lifting and moving patients? Why is using the appropriate patient-carrying device an important consideration? When would an emergency be necessary? And in what ways can proper positioning help a patient's condition? Here's a critical thinking. You arrive at a vehicle crash and find an elderly driver slumped over the wheel. Upon examination, you determine that the patient is in respiratory arrest but not trapped in the vehicle. Which move would be appropriate for this patient?